everyone, this is Dr. Nikita Consul from the Academy of Online Radiology Education. I work at Baylor College of Medicine as a resident in Houston, Texas. And in this month of July 2020, we have provided synopsis of articles that address LI-RADS, contrast-enhanced ultrasound LI-RADS, and pediatric imaging recommendations from the LI-RADS working group. There was also a very interesting article proposing new applications of MRI with molecular targeted probes for monitoring liver fibrosis and treatment response. So this systematic review with meta-analysis of LI-RADS version 2018 was published in JACR and was a meta-analysis of 14 studies that reported on the diagnostic accuracy of version 2018 for hepatocellular carcinoma. They found that overall, LI-RADS 5 had a 70% sensitivity and 91% specificity for HCC, and that there was a progression in terms of percentage of HCC included within each category of LI-RADS as the number increased. So overall, they concluded that increased LI-RADS category did correspond with increased proportion of HCC, and that the LR5 category had moderate sensitivity and high specificity. This prospective study of 130 HCC patients was published in the Annals of Hepatology and assessed the clinical relevance of a LI-RADS 4 versus LI-RADS 5 categorization for a major nodule on CT or MRI. And the way this was done was by comparing the LI-RADS categories with pathology findings for these HCC patients that were listed for transplant and what the pathology showed on the liver explant. Among the patients, they found that LI-RADS 3 had 50% proportion of HCC. In LI-RADS 4, there was an 89% HCC rate, and in LI-RADS 5, there was actually a slightly lower 77% HCC rate. So in this specific patient population, there were no significant differences observed between LI-RADS 4 and LI-RADS 5 in the probability of HCC. And although LI-RADS was overall useful, especially in the lower numbered categories, they found that LI-RADS 4 and LI-RADS 5 had some ambiguity to them. In this article published in Radiology from the LI-RADS working group, 11 pediatric radiologists with expertise in liver imaging came to a consensus regarding imaging recommendations for patients with suspected hepatoblastoma or HCC or other pediatric hepatic neoplasms. They came to this consensus by using a systematic standardized scoring system across many criteria, and in the end came up with recommendations on when to use contrast-enhanced ultrasound versus MRI versus CT, and in addition came up with when to use which type of MRI protocol and when to approach the concept of biopsy. So this was all published as a set of guidelines and recommendations for these pediatric patients and is now available in this article. In this article published in Radiographics, the articles update their prior article on contrast-enhanced ultrasound approach to the diagnosis of focal liver masses by incorporating precursor nodules to HCC and going about this by describing the variation of enhancement characteristics that can occur with HCC versus precursor nodules and the underlying pathophysiology that occurs during hepatocarcinogenesis to cause these variations. The imaging findings are correlated with each type of nodule within the contrast-enhanced ultrasound LI-RADS categories and therefore updates the previous diagnostic algorithm that was provided by the authors in their previous article in 2017. Therefore, in the end, they were able to show that contrast-enhanced ultrasound LI-RADS can categorize all hepatic observations in patients at risk for HCC, including nodules. This prospective study of 96 high-risk patients with biopsied lesions and contrast-enhanced ultrasound was published in a European Journal of Ultrasound, and it was regarding the utility of contrast-enhanced LI-RADS in diagnosis of HCC by assessing its diagnostic performance and inter-observer agreement, and comparing the results against China Liver Cancer Guidelines, or CLGC, for HCC. What they found was that LI-RADS 5 had a sensitivity of 39 to 64% as compared with CLCG, which was higher of 89 to 100%. The accuracy of LI-RADS 5 was 53 to 71% versus CLCG, which was an accuracy of 78 to 86%. However, the specificity of LI-RADS 5 was 93 to 100% versus CLCG had a lower specificity of 29 to 64%. They also found fair to moderate inter-reader agreement for contrast-enhanced ultrasound LI-RADS, which was deemed non-satisfactory. And they did also state, or conclude rather, that LI-RADS 5 had a high specificity, but overall low accuracy and sensitivity for HCC, especially when compared with CLCG. On a related front to the last article, in the same European Journal of Ultrasound, different contrast-enhanced ultrasound algorithms, particularly LI-RADS and ESCULAP, were compared against conventional on-site contrast-enhanced ultrasound interpretation done by experts in the field in terms of all of their diagnostic accuracies for HCC. This was done in a prospective study of 321 patients who had biopsy pathology based on liver lesions that were seen on B-mode ultrasound. They found that contrast-enhanced ultrasound on site actually had pretty high sensitivity. ESCULAP had the highest sensitivity. And as expected, from the previous article discussed, LI-RADS actually had a lower sensitivity but did have the highest specificity. On-site contrast-enhanced ultrasound conventional interpretation actually had a high specificity as well of 65%, while ESCULAP had the lowest specificity. Overall, the diagnostic accuracy of on-site contrast-enhanced ultrasound was actually deemed to be almost equivalent to LI-RADS and ESCULAP. This was a very interesting prospective study of rat models that was published in the latest issue of Radiology, and it basically assessed the ability of advanced MRI to provide staging and diagnosis of liver fibrosis and treatment response for non-alcoholic steatohepatitis. So in this study, rat models were developed and grown in controlled environments in different stages of non-alcoholic steatohepatitis by controlling their diet and various medications. And these rat models were then prospectively analyzed under this targeted molecular MRI for the ability to diagnose and stage their NASH and fibrosis accurately. Of course, their livers were harvested to provide histopathology as the gold standard. ROC analysis showed that collagen-targeted MRI was very useful and sensitive for detection of any initial fibrosis because it essentially was measuring collagen accumulation, while the gadolinium HYD probe was best for detecting and staging fibrinogenesis because it was targeting active disease activity. So in conclusion, the authors stated that this targeted molecular MRI may provide a non-invasive method for diagnosis and staging of NASH fibrosis. That's a wrap for July 2020. For more details, you can read our blog where you can find links to the original publications. Please feel free to share your thoughts and questions with us on the Liver Imaging Forum, and see you next month.